the coronavirus could put many South Africans in hospital over the holidays. And let's not forget, the roads are extremely busy at this time of the year. That means more accidents and more pressure on hospitals. Let's get some details. Reporter Michael Marilia joining us from our AR studios. So, Mike, the health minister wasn't mincing his words last night. He said the system will be overwhelmed if we continue at this rate.
Yeah, that's the message from William Kizer Masego. He's saying that many South Africans could end up spending the holidays in hospital. And of course, it is the worst time of year to be in hospital because there is so much pressure on our healthcare system. He also said that he had written to many of the provincial health MECs a few weeks ago, warning them to get plans in place so that they can deal with a surge in the number of cases. And talking about those cases, Masego, let's take a quick look at some of the numbers just to put those in context for you. So we reached the first peak, the peak of the first wave. On the 24th of July this year, we were at nearly 14,000 cases in a single day. Just yesterday, 6,700 cases. So we're almost halfway to that peak that we saw in the first wave. And just to give you a sense of how quickly the cases can climb, Masego, I want to take you back to the 2nd of November. That was just over a month ago, and we were looking at 770 cases. So it's climbed almost tenfold since the 2nd of November. And of course, all of these cases will translate into some kind of pressure on the healthcare system. We don't know how much yet, but certainly it will translate into some hospital admissions. And also, just to give you some perspective, the last time we were at this kind of level in terms of daily new cases was in August this year. We were looking at about 6,600 cases on the 9th of August. So that's exactly 4 months ago. Interestingly enough, we were in level 3 at that time of the year. We're now in level 1, and yet we have the same number of cases. So that will really feed the argument that some sort of restriction is needed. We'll have to see whether or not government does actually put that in place. But here's the thing, Masego, you mentioned the roads and how busy it gets at this time of year. Of course, road accidents put more pressure on our hospitals. And take a look at this. This is stats, in fact, from the Transport Department. The festive season road deaths in 2019 and early 2020. So we're talking about the 1st of December to the 15th of January. Nearly 1,620 people losing their lives on the roads. Of course, that in itself is tragic, but those are just the deaths, Masego. It's not counting all of those people who survive those accidents and end up in the hospital, putting more and more pressure on the healthcare system. So really, 2020, it's a double whammy in terms of our health facilities. We've got to try and put as little pressure as we can because we are in the middle of a pandemic. Masego?
Well, Michael, I guess it really is about our behavior. It's not the first time that we've heard that the festive season has a lot of pressure on hospitals, ICUs being packed because of violence, because of car accidents. And now it's about us actually putting on our masks and making sure that there's not too many of us in a certain place at a certain time. But thank you very much, Michael Marilia. Of course, will be giving us more updates on that as the day progresses.